Okie dokie, living in a fat swamp, how poverty begets obesity and how we can stop it. Next slide, please, Fiona. Okay, it's universally accepted, of course, that dietary-related diseases are a major cause of morbidity and premature morbidity. And there's overwhelming evidence that obesity levels are higher in deprived areas and communities. That's without challenge. However, it is also clear, sadly, that obesity is still regarded by many, including many who should know better, that it's a lifestyle choice. And we recently had a Deputy Prime Minister and former Health Secretary who supported a Treasury review which recommended abandoning current and planned anti-obesity measures, in conflict with the overwhelming evidence. And also, we need to look at obesity in terms of the wider environment, the environmental context of the places in which people live and work. Access to sources of healthy food and affordable food compared with sources of cheap, calorie-dense and comfort food. Access, these things don't work in isolation. Access to green space and leisure facilities, and of course there's a fundamental difference between access and accessibility. So if you're going to get 2 buses to get to a leisure centre or to a park or a nature centre, that's hardly accessible. And if there's a charge, an entry charge, again, that's not accessible for a lot of people. And I can remember as a very young teenager visiting some relatives in a very affluent part of the city. And one of my cousins suggested, we were about 13 or 14, suggested that we go to a park for a bit of a kick around. And I presumed he meant Cannon Hill Park, which wasn't far from where we lived and was about a mile away from where we were. So I set off in the one direction, and he said, no, he's back up this way. And I thought, where on earth is he going? And we walked halfway up this road, and he got a key out, and he unlocked this gilded gate, and we walked through. It was like walking through the wardrobe in Narnia. I walked through this arboreal arch into a most fabulous private park, and that radicalized me, because I thought, this park is locked and it's private and it's paid for to keep the likes of me out of it. And I felt very strongly about that. And that moment is probably responsible for me being here talking to you about those inequalities. And obesity, there are so many dimensions and such grotesque inequalities around obesity. And one of the more grotesque, I did some work with the Royal College of Physicians on air quality in 2016. And there's emerging, I mean, it's not overwhelming, but there's plausible and sizable evidence that obesity not only modifies susceptibility to air pollution, so that obese people are more at risk of adverse health outcomes have been exposed to air pollution. There's emerging evidence that air pollution may be implicated in the development of obesity. Next slide, please, Fiona. Now, this is a really interesting paper. There's some references at the last slide if you'd like to follow these up. And this is a paper looking at NO2, nitrogen dioxide, and PM10. Those are some of the smallest particles and the most dangerous air pollutants. PM10 and its relationship to exposure, poverty, and responsibility for the generation of those pollutants. And these charts show very clearly, and it'd be no surprise to this audience, that exposure to NO2 is massively determined by deprivation. There's a very clear relationship that poorer people are more exposed to higher levels of both NO2 and particulate matter. And there's an interesting little dip at particularly on the NO2 chart there, which shows that very, very affluent people are actually pretty heavily exposed, more than poorer people. But that's almost certainly due to very affluent areas in parts of London. If anybody has walked down Marylebone Road from Euston Station, will know exactly the cause of that. Next slide, please, Fiona. This slide is looking at vehicle emissions. This was the first paper that had access to MOT data, so it was able to estimate by population group the level of contributions to NO2 and PM10 that various communities make. And here we've got an inverse relationship, that poorer properties, poorer people generate much lower levels of NO2 and PM10 than their more affluent neighbours. So they're more exposed and they're more vulnerable. And they are not responsible for the high levels of pollution that they're experiencing. They're imposed on them. Next one, please, Fiona. And this, of course, relates to poverty. So poorer people are much less likely to have cars, and they're much less likely to have more than one or two or even three cars. And the evidence until fairly recently, there was a disproportionate number of diesel vehicles in multiple car ownership. That's starting to change now as people switch to electric vehicles. But you can see that the stark differences between, and it's a triple whammy, that poorer people are more exposed, they're more vulnerable. There's something about the stress of poverty as well that makes poorer people more vulnerable to pollution. So not only are they more exposed, there's something about the stress which there's some interesting evidence emerging that the pollutants in poorer people actually find the target audiences, their target organs more rapidly than in more affluent people, and they are not responsible for generating those pollutants. Next. And again. And we have a lot of, also, can you go back one? Yeah, thank you. We, as we all know, we have a lot of takeaways and eateries in this country. 1 in 4, 25% of eateries is a fast food outlet of some sort. And in some places, it's much worse than that, as it is in Sandwell. Next. Now, this is a map of Sandwell showing areas that are within a 15-minute walk of a takeaway food premises. So anything that's not green is within a 15-minute walk, and there's a general acceptance that if something is more than 15 minutes away, people are less likely to make that walk. So these are very, very accessible. The green areas are those where it's more than a 5-minute walk. And the one on the top right-hand segment there is Sandwell Country Park, which is a wonderful resource, and it's a beautiful nature reserve and a massive area, and it's very, very popular. It's one of the most visited natural resources in the West Midlands. However, the data from the management of this amenity show very clearly that most people who visit the country park actually aren't from Sandwell. And Sandwell's a very deprived local authority, pretty much across the whole. There are pockets of relative affluence, but it's a very, very poor community. And one of the reasons for the poor uptake by local residents is that there was very, very limited public transport links to the country park. That may well have changed now, but there you have a resource that is not accessible to the local population. Next one, please. And not only are there multiple choices of fast foods, there's a really important issue around the cost of these foods. Food prices have been increasing consistently for many years now. Well, at the same time, the median incomes in the most deprived decile have fallen, and prices increased by a record of 24% between 2022 and 24. And for poorer social groups, it makes absolute sense to source calories from takeaways, because avoiding the costs of cooking is a sensible thing to do. Lee Anderson, of course, talked about producing a healthy meal at 30 pence. And you think, well, have a go at it, Lee, and see how plausible that is, because it's once you factor in the cost of the cooking, it actually doesn't make any sense to go. If you've got to make a bus journey or a couple of bus journeys to actually buy fresh fruit and vegetables and ingredients, which in some communities that would be the case, haul it back home, get it up 5 floors in your block of flats and then cook it. That doesn't make any sense when you can buy cheap, calorie-dense comfort food from round the corner. This presentation describes work conducted in Sandwell, one of the poorest areas in the UK, very high levels of obesity, cardiovascular disease deaths, and where virtually nowhere is more than a very short walk from one or more hot food takeaways. And when I first worked in Sandwell, I worked there from 2009 to 2013, you couldn't help but notice how many takeaways there were, and also how cheap the food was, and that really puzzled me. They're largely mom and pop type businesses rather than big chains, and I thought, I don't understand how they can sell this food and make a profit. The profit margins must be very, very, very low. Next one, please. So why we did this? There's evidence and plausibility that total fat and saturated fatty acids are implicated in obesity and cardiovascular disease. We know that excessive salt is also an important factor in hypertension and CVD, and there are national recommendations to reduce salt content of food eaten outside the home to achieve a safe level. And there was a previous survey in Sandwell, which was an opportunistic survey. It wasn't a particularly well-planned survey. It's shown very high levels of saturated fats and salt in takeaways. And we were also interested in the relationship between unsaturated fats and saturated fats, and the recommended ratio is around 1. And the reason for that concern was the emergence of an alternative to traditional cooking fats in the form of trans fatty acids. And I was utterly convinced that, and this just goes to show the importance of research, because I'd convinced myself that the reason for the very low cost of takeaway food in Sandwell was because these small businesses were substituting saturated fats for frying with trans fatty acids. And that was the original motivation for me to do this, because I wanted the evidence to substantiate it. And it actually turned out to be something completely different in many respects. Next. Right, Sandwell's clearly something close to market saturation. We know that fast food outlets cluster in deprived areas, and that's partly. And I think it's important to say that these small mom and pop type businesses do not target schools. I mean, they do get criticised these businesses are open up deliberately around schools in order to tempt our children with unhealthy foods, and that's entirely untrue. It's about cheaper rents and social desirability. And this is a challenge in terms of promoting healthy diets when you've got this cheap alternative. But it also introduces the prospect of businesses turning to cheaper and more hazardous ingredients as margins shrink, which was what I thought was happening. And trans fatty acids internationally have been addressed in many countries. There are many calls for bans on trans fatty acids in schools across the developed world, and that's been implemented in many places, including New York. To be fair to the larger and more responsible food companies, trans fatty acids have been actively managed and reduced by mainstream manufacturers and chains, but we knew very little about these small-scale hot food takeaways, and they could be potentially major exposure sources in deprived areas. Next, please. So what did we do? Systematic literature review. We agreed a sampling framework with the laboratory. We targeted independent retailers to include at least one in each ward, because I knew that if we missed one ward out or two wards out, the local councillors would be onto us. We included, went beyond products previously sampled in previously published surveys to enable comparisons. And we also took advice from Sandwell NBC Environmental Health to identify foods that were vulnerable to substitution. There was a concern that fish, for example, being marketed as cod wasn't actually cod, it was some cheaper alternative. So there was a consumer protection element to it as well. And the local authority provided us details of all hot food takeaways and very helpfully provided a dedicated officer to purchase the samples. So these weren't formal samples in terms of the legal process. So the businesses didn't know that it was a local authority person who was coming in to buy the food. And these are the generic groups that we alighted on: pizzas, chips, curries, fried battered products, including fish, sweet and sour chicken, which is one of the most popular dishes in Sandwell, according to local intelligence, and saveloys. And I suspect there will be many people, younger people, on this webinar who have no idea what a saveloy is. And it's basically a bright red, highly seasoned sausage. It used to be made from pork brains, but now that's passed a long time ago. So it's an interesting type of product, and have a look at those and make a judgment as you think which is the least unhealthy option of those. Next, please. 252 food samples were purchased. The analysis included weight, total fat, saturated fat, mono and unsaturated fats, trans fatty acids, and salt. I initially, when I was negotiating with the laboratory, I just wanted saturated, unsaturated fat, and trans fatty acids, but they offered me the others as a minimal cost. So I said yes, and I'm so glad we included salt in that. The results were compared to reference standards, including UK guideline daily allowances, which are now referred to as reference intakes, and also a recommendation of the dietary ratio between unsaturated and saturated fats of around about 1 as being the target. Next. There was only one paper we found in the review that recommended dietary standards for takeaway, suggesting a single meal should not exceed 30% of a GDA for any given component. Now, there aren't many data on the frequency of takeaway consumption. There's a US study that reported young people eating fast food 3-4 times a week. Another found 30% consuming fast food on a typical day. There was one UK study reporting 10% of children using takeaways daily, and over 50% twice or more a week. And that just seemed intuitive for me to be an underestimate from personal experience, but that's what the evidence was telling us. Levels of total fat, trans fatty acid and salt in pizzas turn out to be broadly similar to the international literature, although a bit higher in saturated fat. And that sounds like good news to begin with, but actually the news on pizzas was not entirely good. Next. Notable exceptions included total fat in generic meals, and we use pizza and chips as one example. These were at the upper range reported internationally, and saturated fatty acid more than double the internationally reported mid-range. Fries were lower in total fat and salt, although we purchased unsalted products, and again higher in saturates. Chicken and rice meals had higher levels of total and saturated fats and salts than reported in our earlier study, so things had got worse. Almost 70% of products had unsaturated, saturated ratios of less than 1, which is not ideal, and a really worrying 30% at 0.1, less than 0.1, so less than a tenth of the recommended ratio. Next. Almost 70% of analyses exceeded the recommendation that a meal should contain less than 30% of any GDA. Pizzas exceeded the recommendation for all measures. And we're not special here. The American literature was very clear on that. 54 analyses exceeded 50% of GDA for at least one measure, including over 80% of results for saturated fat. 36% of results for children exceeded 100% of the GDA for at least one measure. And I'll repeat that, 36% of results for children exceeded 100% of the GDA for just one measure. 7 of the 26 salt analyses exceeded GDA, which wasn't as many as I thought, but again, these products were all unsalted. Next. And there were some eye-watering, and this is a terrible pun, rather mouth-watering results. 203% of the GDA, pizza and chips for saturated fats for women and children. 173% above the GDA, sweet and sour chicken and fried rice for children for salt. 170% GDA for saturated fats in fish and chips for women and children. Unexpectedly for me, of the 33 results below 30% GDA, 17, half of them, were for trans fatty acids, and 5 of the 13 food groups contained no trans fatty acids. So it started to become clear that the fast food landscape in Sandwell was not actually shifting en masse to trans fatty acids, which completely confounded my expectations, and that was encouraging in one sense. Portion sizes. I actually double checked with the lab, because when I saw the data coming through, which included portion sizes, I thought, well, these are larger than those reported in the American literature. And I've been to America, so I know what their portions are like. And I thought, this must be a mistake. So I rang the lab manager and said, are you sure you got the decimal point in the right place? He said, yeah, these are genuine results. And again, it dawned on me that what was happening here is that they weren't competing in, the small businesses weren't competing by using trans fatty acids to reduce cost. They were actually putting in extra on purchases in order to encourage repeat custom. So throwing in more chips, an extra slice of pizza, just to get the business. And who can blame them? You know, these are small independent businesses. They're locally owned. They're often family businesses. They're an important source of employment. It's a very important first step on the ladder for some communities to get into the world of businesses. You can hardly blame these operators for doing this. It's quite rational. Next.
Patrick, it's Mike here. Just to let you know, it's 1:30 now. So
okay, thanks, Mike. Okay, access to a healthy diet is a fundamental right predicated by many factors, including personal knowledge, choice, convenience, availability, quality, cost, and social norms. It's clear evidence that deprivation compounds all these factors, with poorer people buying more unhealthy, calorie-dense comfort food and fewer healthy ones, while being exposed to circumstances that make such choices inevitable. The consequences of this are manifest in Sandwell with its burden of obesity and cardiovascular disease. We have become simultaneously a food desert and a fat swamp. Next, please. Virtually the entire population of Sandwell live a stone's throw from at least one takeaway. These foods are a public health issue of real significance. We found hazardous levels of exposure to fats, saturated fats, and salt. Over half the samples exceeded at least 1 GDA for fat, saturated fat, or salt, with one meal exceeding the recommended levels for all measures. The great majority of foods provided more than 50% of a GDA in a single meal, and of particular concern, over 80% for saturated fats. Next. Levels of salt, a particular concern. About half of the food groups exceeded the NICE target of 3 grams per day, and there were, as I mentioned earlier, some exceptional results reported. Given the evidence that young people in some communities routinely eat takeaway foods 3 or 4 times a week, 36% of results for children exceeding 100% of GDA for at least one measure in a single visit is a serious public health threat. Next. Trans fatty acids results were reassuring in some respects, although high levels found in pizza and chips. They've been banned in some areas, and CDC has recommended removal from school meals. It's clear that the food industry has responded to these concerns. It's also clear from the analysis of foods in Sandwell that why it wasn't as ubiquitous as I was dreading, it's still a real exposure hazard. Next. These results are important as they relate to small independent outlets rather than large change. It's sobering that young and the deprived are more likely to be using fast food takeaways. New York has shown the impact a municipal ban can have on levels of exposure. This is a limited option for Sandwell, where the market is dominated by small independent businesses and the limited powers that councils have to legislate. And of course, they might simply go and visit these takeaways in the neighbouring local authority. Next. Supersizing of portions. It's entirely legitimate for local authorities to consider their powers, planning and licensing it has available, to lobby government and delegating powers to local authorities to respond to local public health issues. Local authorities have a duty to reduce inequalities and collaborate with neighbouring councils. Next. Environmental health training centres have critical roles in ensuring food safety and nutrition. And I think we also need to consider how many people die a year in the UK from food poisoning as opposed to obesity. It's about 180 people die from food poisoning a year. There's over 30,000 from obesity. So perhaps we've got our priorities the wrong way round here. And this is non-regulatory work in encouraging the food industry to use healthy ingredients and healthier techniques, in my view and my experience, is actually more important than enforcing basic food hygiene standards. Next. Right, people in Sandwell are exposed to larger portion sizes, and in other regions, some levels, it's getting worse. Limited options to escape this highly compromising environment. A package of interventions is required to address this, and immediate action is required. Next, I think I'll skip through these next couple. There are some examples of good practice. So if we go on, next one, please. And we are in a bad place in this country. The disparities in childhood obesity are more marked in the UK than in many other high-income countries. The OECD show that in the UK, the gap in overweight and obesity prevalence between children, the most least deprived affluent families in the UK, was 26% in 2018, compared to the EU average of 8%. So we've got a particular problem in the UK. Next. And there are some good examples of good practice. There's a really interesting programme in Leeds for Henry, health, exercise, nutrition for the really young. And that had an impact, a measurable impact, significant impact on reducing obesity, particularly in deprived communities. And that was run out of children's centres. Next. The problem we have here is that the Sure Start centres have been closed. Between 2010 and 2020, more than 1 in 3 were closed. In 2009, 2010, there were 3,600 centres. And austerity slashed those numbers by up to 85% in some areas. In Staffs, 46 of the 54 centres were shut, and that has consequences. There's a really good programme in Amsterdam from which we could learn. It's a long-term municipality-led programme to improve children's physical health, diet and sleep through action, home, neighbourhood, school and city. Next. Whole system approach, which works. The prevalence 2 to 18-year-olds with overweight or obesity in Amsterdam fell from 21% to 19%. I mean, this sort of declining trend is very, very rarely, if ever, been observed in the city. So we have got examples of good practice that we should be considering. Next. I'll start wrapping up now, Mike. There are strong political, social and economic reasons for not considering a blanket restriction on takeaways. A package of interventions is required using local planning and regulatory powers, environmental and educational interventions, targeting children, young people, consumers and businesses, addressing portion sizes. But we've also got further and further away from understanding our diet and our relationship with food. And there are many people who don't know how to prepare healthy foods. I remember during COVID delivering a food parcel to a young man in a very deprived state in Quinton, and it had a leak in the bag, and he asked me what it was, and I said, it's a leek, and he said, can I eat it? And I said, oh yeah, of course. And he pulled it out and bit into it. He had no idea that it needed to be prepped. But this is all ultimately about, this is one of the most egregious examples of poverty and inequality. Next. And you know, we can learn from recent history. You know, between 1997 and 2010, life expectancy in this country, the gap between rich and poor local authorities started to be closed. We took 1 million children out of poverty through working tax credits. Infant mortality was reduced by a third. And this is when we were a poorer country. So we can do this. And I'm misquoting from John Middleton, who was Faculty of Public Health president at the time. I believe the programme of Sure Start maternity grants, Sure Start Plus for teenage moms, combined with the minimum wage, the working families tax credit, commitments to reduce teenage pregnancy and child poverty, all had a part in immunising the next generation against what had been a cycle of deprivation-driven morbidity and mortality. Next. Oh, and those are the references. So I've finished with about 20 minutes to go, Mike. I hope you're not going to tell me off.
No, that's brilliant and pleasantly surprised. Thank you, Patrick.